especially a front tooth? Hi everyone, welcome to my channel. Are you worried about a single discolored front tooth which you have noticed recently but it wasn't there, or maybe you have noticed the changes in it slowly? So yes, I'm very sure that you must have either had it or there would be a lot of people around you who would have had it and you would have noticed that. The front tooth, especially when it's discolored, it affects your confidence, your smile, you are not so happy about it and you don't know what to do about it. Let's just find out what are the causes which can cause this discoloration of just single tooth, as well as let's just see what are the treatment options which are available in case of the same problem. The most common cause is that during your childhood you would have undergone some trauma to the front teeth. Like maybe when you were playing, you would have got hit by a ball, or you would have fallen with your front tooth and had an injury, which at that point of time wouldn't have caused any discoloration. Sometimes there are some patients who come and they don't even remember that they had an injury some years back. In your childhood, that is something which goes unnoticed at that time because maybe you would have had a small swelling at that time which would have vanished, and some of them don't even have any symptom at all for a very long time. So it just goes unnoticed, not there in the patient's mind. But whenever we see a discolored tooth, the first thing that we ask for is if they had had any injury in the past to that tooth. The second cause can be because of internal resorption. So the internal resorption is some sort of I wouldn't call it a disease, it's a condition wherein the innermost layer of the tooth, that is the pulp, they start resorbing by itself. It doesn't have de novo, as it doesn't happen just like that, but there might be the injury which has happened can be a cause for that. Sometimes there's no internal resorption that's seen, but the pulp tissue inside just becomes dead, and because of which, slowly there are a lot of materials that get accumulated, etc. And this internal resorption can be something which doesn't affect the enamel or the dentin. It's just the innermost layer that is affected, which causes this discoloration in due course of time. As we all know, there are different layers of teeth. I have already mentioned in so many of my videos that the innermost layer of the tooth is which you cannot see, and that's called the pulp. And the pulp is the area where you have the blood vessels, the nerve supply of the tooth, which in turn will help you have any sensation when you're biting onto something hot or cold, when you're biting something very hard. All this happens because of the innermost tissue, that is the pulp. And outside the pulp, you have the dentin, and then you have the enamel, which is one of the hardest structures in your body. If there's a problem with the bone, then it's so easy because it has a repairing capacity, whereas in case of an enamel, that's not present. So whenever there is a blow or a hard injury, sometimes the enamel is affected. It being one of the hardest structures, sometimes may not break at all. But the impact of the injury is so bad that the innermost layer, there is a pulp, which can be affected because of that. So after the injury, because of the impact, the blood vessels which are present inside the pulp, they are going to get harmed. The blood vessels may rupture. Along with that, there might be some nerve cells which are damaged. So sometimes the sensation to the tooth doesn't come back. And also the blood vessels, once it starts disintegrating, what happens is there are a lot of products which are present in the blood, as well as this disintegrating matter which is present. All these gets accumulated inside the tooth. And as you all know, whenever there is no blood supply, the waste products from the body, how is it removed? From every part of your body, the waste products gets collected in the blood, and that's the bloodstream is what is going to remove the waste products from there. In case of a tooth, when it is dead, nothing is going to happen. So after the injury, the blood vessels are harmed, there's no blood supply to this teeth, and the immune system in the beginning will try to fight with that. It will try to come, remove whatever is possible from there. But on a long run, slowly, the immune system will also stop working towards that area because of the lack of blood supply. So, when the impact happens in the initial stages, in the initial years of the child, most probably you don't see any discoloration. But as the child grows, you will be able to see that the tooth slowly starts changing its color towards fading, like fading white, then slight yellowish, and sometimes it becomes very much yellowish that it is so visibly seen once the patient is an adult. So all these products from the bloodstream, the dead and degenerated things, everything stays there, and that is what is going to give this discoloration to the tooth, which is noticed after many years only. And in the beginning, there might have been an infection that would have happened, but at that time, your immunity is very active. So what happens is the immune system acts and it'll be able to remove all the waste products as well as all the bacterial things, etc. from there. So the infection which starts a slight way might just be removed and you may not even realize that there was an infection. So this discolored tooth, if once you're an adult or after many years, this discolored tooth which is having this dead and decayed matter might get infected. Sometimes it just doesn't get infected and stays as such. So if your concern is just the discoloration of the tooth, still we need to check what is the cause of that. We need to take an X-ray and find out. And after that, most probably you would need to get done, you need to do an RCT on the tooth. The root canal treatment is done in order to remove all the dead and decaying matter which is present inside that particular tooth. So if you're just going to mask this discoloration without doing a root canal treatment, there's a very high chance that after some time you might start to develop an infection on that tooth, and this time the infection will be much severe. So again you will end up having to do a root canal. So most of the time whenever there is a discoloration, and this being the most common cause of discoloration, what is done is we do a root canal treatment in order to remove all the dead and decaying matter. The tooth heals well, and after that the crown part, based on if there is a chip off or the tooth surface is in a very good condition as in externally, what we can do is we can either give a cap, but in today's time we have such good aesthetic materials which can be used on the tooth surface. It can be veneers, which is slightly expensive, but if your tooth is an ideal for veneer, then that's the best that you can give in case of front tooth. Your aesthetic smile will be preserved. Other than that, if it's not a candidate for a good veneering, then giving a very aesthetic crown. You have crowns which are available now, not just the regular ceramic crowns. You have the zirconia crowns which are aesthetically so good that it will match the other tooth surfaces so well. Like it has so many shades, it can be made according to your shade, customized to that. It's just that you need to pay slightly more compared to a regular ceramic crown. So once you put that, you will not even realize that this was the discolored tooth which was present in your mouth. You also have certain tooth whitening procedures which can be done in case of a discolored tooth. But that discoloration is, if it's because of this kind of impact or injury, will not be ideal to do that. Tooth whitening is a procedure which can be done on a single tooth only in certain set of cases, not for all the cases where there is a damage already which is there underneath. Instead of treating that, if you're just going to do the tooth whitening, it's not going to help you. The cause needs to be removed, and then only the aesthetic part is considered. So please do get a treatment done. A discolored front tooth always will harm you with your confidence, and it's gonna be something which is not very pleasant for somebody to watch when you're smiling. So if it's just a single tooth which is harming you, why don't you get it treated and make your smile a very beautiful one? That's all for now. Thank you.